I'd like to talk to you today about a new mobile pain treatment program for peripheral neuropathy now available in Texas. I love Texas, by the way. I've got a lot of friends from Texas, and I love visiting. It's a beautiful place, beautiful state. But I love the state, and I'm excited to talk about this for you because now we have a mobile program for everyone living in Texas to have this peripheral neuropathy pain condition treated and have it be treated in your own home. So the actual treatment program we're working with is called neurofunctional pain management. So neurofunctional pain management is a combination of three different therapies combined to offer a chronic pain treatment option for people. This is a non-pharmaceutical, non-surgical, non-invasive, and non-chiropractic treatment program. And again, now available as a mobile program where the nurses come to your home and treat you on site where you live. And I'm sure that most of you have never heard of this before, so I'm going to go over some of the components of the program. But just wanted to briefly mention here too that I understand most of you watching this have peripheral neuropathy pain. I've worked with, I've talked to and I've worked with lots of doctors. I put this program into many doctors' offices. I created this treatment program back in 2018 as a program that doctors could use in their offices to treat patients with all sorts of pain conditions, and over the years discovered lots of reasons why it was, sometimes effective in the offices and sometimes not. But one of the things that we noticed is that oftentimes the patients who need this the most are the ones who can't even get into the office. And getting into the office too, this is a program that takes several treatments over several weeks. I'll explain that in a moment. But that's another reason why it was hard to make this work in offices, is because making as many trips into the office to do this, and of course being in actual pain. That peripheral neuropathy pain it's difficult to walk, it's difficult to travel and to get around. Patients don't like doing that. Burning, tingling, numbness, all of that adds up to I don't really want to go anywhere. I need pain relief and I need treatment, but man, it's really difficult to get around. And so we notice that all the time in these offices we put the program in. All these patients would want to do it, and I remember watching patients just make that struggle from the car to the actual office. It was hard to watch sometimes. People were literally suffering with every step to get in. So I knew years ago that this needed to be a mobile program, and we were working on trying to make that happen, and finally made it happen. And we're moving across the country and introducing it to new states. Again, now available in Texas for as a mobile program to treat peripheral neuropathy pain. So very excited to bring it here. Okay, so the three components of neurofunctional pain management: electroanalgesic therapy, IV nutritional hydration therapy, and health coaching. So I want to talk about each one of those a little bit, and we'll explain some about why you probably haven't heard the treatment before, why you've never heard of it before, why most of your doctors haven't heard of it, and why they don't recommend it already. There's good reasons for that, and I'll explain those. Talk about the efficacy rate, the duration, and all those things in just a moment here at the end. And again, like I mentioned in the description, this is covered by Medicare and commercial payers. So just keep that in mind as we talk here. Okay, electroanalgesic therapy. This is a high pulse electrical current. A lot of people out there would say, "Oh, is it kind of like a TENS unit?" Most people know what that is. It's like a muscle stimulator that you can, a lot of offices have those. You can buy those on Amazon. There's all sorts of different versions of them. But the short answer is no, it's not the same thing. It is a TENS unit is a muscle stimulator. Electroanalgesic therapy is a neural stimulator. So you are actually stimulating and depolarizing pain neurons, and that's one of the reasons why it works so well. So when you depolarize this neuron, what you're doing is you're interfering with that pain and inflammation cycle. Most of you probably heard this. Doctors have mentioned that, pain creates inflammation and inflammation creates more pain, and there's this ongoing cycle. And then you've got this chronic pain condition as a result of that. And so most of the pain management work out there and pharmaceutical research in that field is designed to somehow reduce or eliminate that ongoing cycle. That anti-inflammation is one of the key objectives of so many things. Try and get the inflammation down so that we can reduce the pain, so we can keep the inflammation going down. So all those options out there are trying to interfere with that cycle, and that's what this is doing very effectively. So depolarization. So if you were to depolarize this pain neuron, and keep it depolarized. There's a term called sustained depolarization, where you keep the current going, keep the electrical current going, keep that neuron depolarized for, our treatment programs are an hour long. So keep it depolarized for the duration of that hour. You can expect for that to last several days, the outcome of that depolarization event to last for several days. Years ago, maybe 20, 30 years ago, when they were first bringing this to market, they actually used it as a nerve block in different scenarios. And one of the side effects of that would be, okay, we're going to use this electrical nerve block. The side effect might be that you might not feel pain for, a number of hours or potentially days afterwards. Nothing to be alarmed by. They're just basically stating this is a side effect, the same way you have side effects with any other, analgesic therapy or injection or something like that. And it didn't take long to figure out that, oh, well, if you have several days of no pain relief, then why wouldn't we just keep doing that actual electrical treatment and actually produce an ongoing pain relief outcome? So what ends up happening is if you do the treatment on a regular basis, you create this cumulative effect of ongoing relief. So what we've noticed is that if we do the treatment for 1 hour, twice a week for 8 weeks, right? We have this ongoing program for 8 weeks long. We will expect the patient to have an outcome that lasts for months and months afterwards. And most patients that we work with have seen months and months of success after the program. What is the success rate of the total program? We're looking at across the board, 85% success rate on across about 24 different pain conditions that we work with in all these doctors' offices. That 85% number, that's something that we've asked all the doctors we've worked with. What is your best estimate of success for all of these patients? Just thinking through, looking at your notes, everything. What's the success rate of this program? And that's what they've all, on average, most of the doctors have said, yeah, it's about 85% successful in relieving a greater than 50% reduction in pain. And that's a huge win in the field of pain management and pain therapy, to have a greater than 50% reduction in pain, and then to have it last for potentially months. And that's what we've noticed, is that the objective is to have a 3 to 6 month duration is our hope and our objective in the program. I've seen plenty of patients go longer than that. I've seen some patients that have gone, 6 to 12 months. I've had some patients that actually come into the office and say, yeah, I had my program, I finished it over a year ago, and I'm just now starting to have pain again. So it's worked for me for a whole year. So that can happen, absolutely. But not everybody has that long of a duration. But some people their body's very responsive to the treatment and works well for them. So that being said, the electroanalgesic therapy, it's been FDA cleared and in the market for 35, almost 40 years now. It's well established as a therapy. It's not new, and that's to our benefit. It actually has history in the market with probably hundreds of doctors. So then again, I know you're asking the question, then why haven't I heard of it? And I'm going to make the skeptical. Why haven't I heard of this? Right? I've talked to so many patients who've literally made that face. If it's so good, I would have heard of it by now. This is obviously something not true. It can't be true. And I've actually talked to a lot of doctors who said the same thing. Well, if it's so good, why haven't I heard of it before? And I'm like, I'm in this field. I should know all this. And of course, you should. Most likely, you probably have heard of it in some capacity. But there's a reason why you have, as a patient, haven't been offered this treatment, and why most doctors are not being taught and trained on how to do this. Again, there are hundreds of doctors in the country out there who have been doing this and do have these devices in their office, and they use it sometimes on a regular basis. Most of them don't. And I'll explain that here in just a minute. The reason why most of them just don't do it at all. Even doctors I know who actually have a device in their office and don't use it at all. And there's good reasons for that here in a second. So electroanalgesic therapy is the first component of the treatment. Works really, really well for treating pain, does all these things I mentioned, depolarizing the pain neuron, and it also is stimulating the release of neuropeptides and neurotransmitters. And those will actually create this very good and a good feeling effect, a kind of a euphoric effect of what a lot of people describe as kind of like a runner's high. So the effect that you feel after a good run or a good workout or a good hard day's work, you just feel good. That's sort of the effect that's occurring after one of these treatments with the neurotransmitters and neuropeptides being released during the treatment. So that's the electroanalgesic therapy. The second component is the IV nutritional hydration therapy. Most chronic pain patients are chronically dehydrated. They're also chronically nutritionally deficient in something, some vitamin or mineral that they're lacking. All of those things contribute to their actual chronic pain issue. So offering the nutritional hydration IV is a strong component to the program. We've noticed over the years that the people who do the IV and the electroanalytic therapy combined end up having a much stronger outcome. So they'll have a stronger success outcome that will have a faster onset of success. We've seen that it starts working faster. And they typically have a longer duration of outcome. So that's what we've observed from all these patients being treated. By the way, we've treated, I would say, thousands, maybe even tens of thousands of patients over the years with this program since I created it back in 2018. So we've got some pretty good history of activity on this around the country and a lot of great success. So we know it works extremely well for a lot of different pain conditions just from all the history of treating patients with it. So again, very excited to bring it to Texas in the form of a mobile program. Okay, so the third component of the program is the health coaching. And a lot of people are thinking, okay, health coaching, I know, eat better, sleep, all these other things. It's a little bit more than that. One of the things that we've noticed over the years is that someone in chronic pain, there's just very, very little motivation to try and just be healthy. All right. Oh yeah, just be healthy and you'll be better. Okay, sounds great. I'll do that. While I'm suffering in chronic pain today, I'll try and eat better. And by the way, did you say I should go out and go for a walk to be healthier? Because that doesn't sound like a very fun idea either. When you have chronic peripheral neuropathy pain, walking is not necessarily something you want to go do. And everybody knows that. And so a lot of doctors know this too. And again, doctors of all kinds, primary care doctors, internal med, pain doctors, they all know that peripheral neuropathy is very difficult to treat, and they wish there were better options. And that's why we're bringing this to the market. That's why we're doing this, to bring those options out there. So that being said, the health coaching is when the patient actually is starting to get out of pain. They suddenly start having motivation to do everything that they hadn't before. There's a light at the end of the pain tunnel. Now they can see that it's working. Okay, I'm getting out of pain. This is great. I haven't been out of pain in years, maybe even decades. I'm pretty excited. I'm motivated. And I'm going to make some life changes now. I'm going to start eating better. I'm going to start getting more exercise. I'm going to stop bad habits. I'm going to start sleeping better and drinking more water. All of these things start happening. And the nurse that's coming to your home to do your program is going to review these health coaching topics with you during every treatment event. So you're going to get a little bit of additional information and knowledge. They'll set goals with you and they'll track these things with you, help you get better, because as you're getting out of pain, there's motivation to actually succeed now, where there likely may not have been before. So that's exciting. That's really exciting. And so those three things together will produce a very strong outcome, and that hopefully will last for many, many months. Ideally, the health coaching component could help you extend the duration of your outcome. If you were able to get out of pain through the program over 8 weeks, that health coaching and the lifestyle changes and overhaul that you make, those could very well keep that success rate going a very long time. So the health coaching is a really important part of this overall. Okay, so why haven't you heard of it? Why don't doctors do it? Right? That's the question I get asked all the time, practically every day. If it's so great, why haven't I heard of it? And why doesn't it, why don't doctors do it? So I mentioned it already. The 1 hour in the office twice a week for 8 weeks, that is almost impractical or even impossible for a lot of doctors to accommodate. Imagine if everyone going to one doctor, a pain doctor in town, and they were trying to do this program. They just do not have the space. They don't have the space. They don't have the time. They don't have the equipment. They don't have the staff. They're just not set up for this. What they're set up for is to help a patient who has a pain issue, and they can get them treated today with a pain issue. And so, prescribe a medication. We can do this injection. We can do this interventional procedure of some sort. We can do these one-time events because we have thousands of patients that need their attention, right? Or need our attention. Not speaking as the doctor. They are looking at this and saying, this is impractical to try and do this neurofunctional pain management program. No matter how great it sounds to them, they're like, this doesn't work. We just can't put this in the office. Don't have time. That is where the mobile program solves all these problems. We can actually keep all of that activity out of the office and actually have it conducted in the patient's home by a mobile nurse who will actually go out and do the treatment for you. So that's what we're doing. how do you get started? And by the way, I mentioned this, covered by insurance, Medicare and insurances, right? So how do you get started? Well, I have a link to our site here in the description of the video. Go there, check it out, read about the site, read about the program, excuse me. And on there, there's an insurance form you can fill out. There's a get started page. You can go there and just, get started, fill out the insurance. You can actually go straight to getting a telemed visit with one of our doctors to get the program ordered for you. Or you can schedule a chat with one of our nurses that's local to you to actually, see, hey, what's this program like? How's this going to work? I would like to talk to one of the nurses. But yeah, we can get you straight into the program very simply. You just need to get your insurance and do that verification to make sure you're covered and good and everything looks fine. We can get you in the program. One of our nurses will reach out and get you scheduled as well. I really hope that we can get you going in this program. It is safe, it's effective, it's covered by payers, insurances, and it, again, I've seen thousands of patients succeed in this program. I really hope that we can bring this to you and make this work for you. Again, this is the new mobile pain treatment program for peripheral neuropathy that's now available in Texas. I look forward to seeing you. Thanks so much.